Hello and welcome to episode 111. Today we're going to be talking about a superstar of our Chinese herbs, Chái Hú, Bupleuri Radix or Bupleurum root. And without further ado, let's get into it. Today we're going to be looking at another single Chinese herb, Chái Hú, Bupleuri Radix or Bupleurum. And this herb is in the Chinese medical subcategory of cool acrid herbs that release the exterior under the category of release the exterior herbs. It is an incredibly important and commonly used Chinese herb that belies its category as it is very useful for lots of conditions and not just for colds. And as always, we'll look at something different. Today we're going to do a Chinese herbal legend on this herb. We don't have a lot of those. There are over 400 Chinese herbs, and the Chinese Herbal Legends only cover 50 of them, but we have one today, so we're going to look at that. Please join us as we explore one of our medicine's premier herbs. This is absolutely a top 10 herb, if not a top 5 herb in Chinese medicine. But before we get into that, I do want to talk about we have an amazing special for our courses. If you use them for continuing education, professional development, or just for your own edification, we are offering 50 hours of courses for an unbelievable price. Normally this would cost $750. However, with the special code 50 CEUs, that's 50 CEUS, this is going to be only $325. It's less than half. That's a lot less than half off. And let me tell you something else about these 50 hours. You choose them. You get to choose whatever 50 hours you want to do. So it's whatever you're interested in. Plus, you can get a free signed copy of one of my books. Just pay for shipping and handling. That is a free copy of Integrative Pharmacology, combining modern pharmacology with integrative medicine, or Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. Just go to the webpage www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org/CEUS1 or /CEUS1 for this amazing deal. Luckily, today's herb is one of those that is in the book Chinese Herbal Legends, 50 Stories for Understanding Chinese Herbs. And therefore we get to look at a traditional story about this herb. Who was a candidate who had succeeded in the highest imperial examination. That's high level society stuff. And he had a farmhand named Erman. In the autumn of one year, Erman suffered from a warm pathogen disease which caused him to be continuously either cold or feverish. When he was cold, he shivered all over, and when he was hot, he sweated all over. Hugh saw that Erman couldn't work for him, and he was afraid that his family members would also be infected with the disease. Erman, I don't need you. You are fired, he said. Master, I have no family or friends to go to. Besides, I am seriously ill. Where can I go? Said Erman. It is not my business. When you work one day for me, I give you food for one day. You can do nothing now, so I will not give money to a useless man like you. I have worked very hard these days. How can you be so cruel? Let others judge this matter. On hearing this, Hugh was afraid that when the other farmhands heard this, they wouldn't want to work for him, so he quickly corrected himself. Erman, now you should go out to find a place to stay for a while. When you have recovered, you can come back again. Here is your pay. Please take it and leave. Erman could do nothing, so he left Hugh's land. As soon as he left, he felt sometimes cold, sometimes hot all over his body, and he had pain in his legs, so that every step was a struggle for him. Dizzily, he came to the side of a pool. There was little water inside it, and its edge was overgrown with weeds, thick reeds, and small willows. Because he could no longer move, he lay down on the overgrown weeds. After a day, he felt very thirsty and hungry. Without any strength, he couldn't even stand up, so he dug up some grass roots with his hands to eat. In this way, he kept alive for 7 days, eating only grass roots. 7 days passed, and all the grasses around him were eaten. He tried to stand up. Suddenly he felt strong, so he returned to Hu's land. When Hu saw him, he frowned. "Why have you come back?" he asked. "Are you all right?" "Yes, I will go to work now." Erman went to the fields with a hoe on his shoulder, and Hu had nothing to say. From then on, Erman never had a relapse of this disease. Some days later, Hu's son fell sick from this same disease. Hu had only this one son, and he loved him very much. So he sent for many doctors, but none could cure the disease. Suddenly, he remembered Erman and went to find him. "When you were ill some days ago, what medicine did you have?" he asked. "Master, I had no medicine." "If that is so, then how was your disease cured?" "It was cured by itself." Hugh did not believe him. "You must have eaten something. Tell me at once." "After I left your house, I went to the pool outside the village and fell down there. When I was thirsty and hungry, I dug up some grass roots and ate them." "Which grass roots?" "The grass roots that you use as firewood." "Lead me there at once." "All right." Erman led Hu to the side of the pool. He dug up some of the grass roots that he had eaten and gave them to Hu. Hu went home quickly and ordered someone to wash and decoct them. Then he let his son drink the medicinal liquid. After his son drank this for a few days, his disease was cured. Hu was very glad. He named the medicinal herb Chái Hú because it was originally used as firewood, chai in Chinese, and because his family name was Hu. So he didn't even give any credit to Herman. So that is an herbal legend of this, which is interesting because when we look at the translation of this herb, it doesn't talk about firewood. It doesn't talk about a person's name. So we'll see that in just a minute here. So let's get into our herb, Chái Hú, Bupleurum root. And the family is Apiaceae family. There are two standard species for this. The first one is Bupleurum chinensis DC. Remember, DC refers to the biologist who classified it, and this is called Chái Hú. And then there's also Bupleurum scorzonifolium. That is classified by Wild. Wild is the biologist, and that's a shortening. I'm sure it's something else longer than that. And this is called Chái Hú. The medicinal part is the root. And in English, what Chái Hú means is twigs of the barbarians. So, Hú usually means barbarians, which basically means anyone outside of China. Other names for this herb include hare's ear root, thorowax root, Chinese thorowax, red thorowax root. Now, we're going to see there's lots of different spellings for this thorowax that we're using here. One is one word, Thoro wax, W-A-X. Another one is thorowax, which is Thorough, wax. And there's another one, two different words. The first word is Throw, thorough, and the second word is wax. So the others are all together. So it's interesting, different spellings of all this. So red thorowax root, shrubby hare's ear, sickle leaf hare's ear, thorowax, which is one of the other spellings. And in totally blanking on it, the Divine Farmer's Materia Medica, it is called Di Shun, which means earth fuming. Japanese, it's Saiko or Saiko, S-A-I-K-O. I don't know how to pronounce Japanese. And in Korean, it's Siho, S-I-H-O. Again, I don't know how to pronounce Korean, so I'm doing my best here. Let's talk briefly about this Apiaceae family here. The Apiaceae family is the parsley or carrot family and includes edible plants and spices such as the carrot and parsnip, anise, celery, chervil, coriander, caraway, cumin, dill, and fennel. Poisonous hemlock is also a member of this family. There are about 34 genera, and Elpil says there are about 300 genera, and 3,700 species. So that's a big difference between 34 genera and 300 genera, and 3,700 species. They have hollow stems, tap roots, and flat-top flower clusters known as umbels. A previous name for this family was the Umbelliferae, referring to these umbels, which is where the stems of the flower cluster radiate from a single point at the end of the stalk, kind of like an umbrella. So that is the Apiaceae family. Getting back to Chái Hú, Bensky and his team says the dose is 3 to 9 grams. Chen and Chen say it is 3 to 10 grams with a maximum dose of 60 grams. So that's a big maximum dose. They also say treatment of organ prolapse relies on only a small dosage, 3 grams, to raise yang qi. Treatment of malaria, however, requires a larger dose of 10 to 15 grams. Brown Wiseman says the dose is 3 to 10 grams as well. So they agree with Chen Chen, but don't get into all the different dosing or the maximum dose. Category for this herb. Bensky and his team put this herb in the cool, acrid herbs that release the exterior subcategory under herbs that release the exterior category. Chen Chen say it is in the wind heat releasing herbs subcategory under the exterior releasing herbs category. And Brandon Wiseman say it is a cool, acrid, exterior resolving medicinal under the exterior resolving medicinals category. So they all say the same thing with slightly different approaches, translations. So there's no dispute in what category it belongs in. Both Bensky and his team and Chen Chen say it is bitter, acrid, and cool. And Brandon Wiseman agree, saying that it is slightly cold rather than cool, which to me, I think is probably the same thing. You know, saying that something's cool or slightly cold seems to be, to me, at least language-wise, to be the same. Bensky says it enters the gallbladder, liver, pericardium, and triple burner, while both Chen and Brandon Wiseman say it enters the liver and gallbladder. So Bensky adds in the pericardium and triple burner, while the other two textbooks do not. History. Both Bensky and his team and Chen Chen say the original source of this herb is the Shendong Ben Sao Jing, or Divine Husbandman's Classic of the Materia Medica, written in the 2nd century CE. We've discussed this book quite a bit as we go through our Superbs Herbs episodes. And remember, this is the first existing book on individual Chinese herbs. So if an herb is listed in the Shendong Ben Sao Jing, it is amongst the oldest herbs in Chinese herbology. So it doesn't mean there aren't other books, but these are the books that we have, and is the only one. And it's a good size. It talks about a lot of herbs. And we'll talk about, it's interesting too that this herb is in this book. We'll talk about it in just a minute. Before we do that, let's talk about exterior releasing herbs in general again as a category. We have now discussed this category and subcategory of herbs several times during our adventures examining Chinese herbs. Today, rather than quoting Bensky and his team, let's look at what Chen Chen have to say about this category of herbs. Substances that release the exterior act to dispel pathogenic factors from the external and superficial parts of the body. The term pathogenic factors describes normally benign environmental factors such as wind, cold, or heat that are combined to disrupt normal physiological functioning and express themselves in the form of wind cold and wind heat. With drastic or sudden changes in the weather, or with a decline in health or immunity, these factors commonly attack the exterior or superficial parts of the body, that is, the skin and muscle layers. Therefore, an exterior syndrome refers to a condition characterized by wind cold or wind heat attacking or invading the skin and muscle layers of the body, causing symptoms and signs such as aversion to cold, chills, fever, headache, muscle aches and pain, the inappropriate presence or absence of perspiration, and a superficial pulse. The herbs in this category stimulate immune response, alleviate pain, regulate body temperature, and induce perspiration. They are most often used to treat common colds, influenza, and complications of complex internal disorders. Clinically, exterior releasing herbs fall into two categories to address the problems of exterior wind cold or exterior wind heat syndromes. 1. Dispel wind cold. These herbs are generally acrid and warm in thermal property. They induce perspiration, dispel wind cold from the exterior, and promote warming and relaxation of the skin and muscle layers. And 2. Dispel wind heat, and that's the subcategory that this herb is in. These herbs are commonly acrid and cold in thermal property. They dispel wind heat to relieve fever and pain or inflammation in the throat, eyes, and skin. Herbs from both categories are generally used in the treatment of common colds, influenza, bacterial infections, asthma, coughing, wheezing, measles, chest congestion, nausea, vomiting, edema, arthritis, and eye disorders. Herbs that release exterior may also serve multiple purposes: to regulate qi circulation to relieve pain, relieve wheezing and dyspnea or trouble breathing, dissolve phlegm, promote the eruption of measles, relieve nausea and vomiting, regulate water circulation and eliminate dampness, and brighten the eyes. Accurate differential diagnosis of the external pathogen and the degree to which it has penetrated is of vital importance. Treatment of wind cold and wind heat can be significantly different. Furthermore, it is important to determine the basic underlying condition of the patient prior to prescribing any herbal formula. Pre-existing constitutional deficiency or chronic illness may require the addition of tonics to enhance the overall therapeutic effect. However, tonics must not be used alone or casually in the presence of an exterior condition, as this will only send the pathogenic factors deeper into the interior of the body, thus complicating the illness. We've been told in our Chinese medical schools over and over again, don't tonify during an external attack. You tonify the pathogen, not the person. But that's not true. We are allowed to tonify, but we need to do it appropriately and in conjunction with treating the exterior condition at the same time. Cautions and contraindications. Many herbs that release the exterior do so via inducing perspiration. Overdose, prolonged use, or inappropriate use of these herbs will consume qi and body fluids, resulting in qi deficiency, dryness, and/or yin deficiency. Therefore, they should only be used when necessary. I want to emphasize this. These are not things that are used to prevent a cold. They're used to treat a cold. Furthermore, intake of these herbs should be discontinued immediately when the desired therapeutic results are achieved. Herbs that release the exterior should be prescribed with caution for individuals who have a deficiency of qi, yin, blood, or body fluids. Exterior releasing herbs should be used with caution in patients with an exterior condition accompanied by sores and abscesses, Linjiang or dysuria syndrome, that's trouble urinating, or bleeding. So they should not be used, or should be used with caution in those conditions. Processing. Many herbs that release the exterior are aromatic and contain volatile essential oils. Cooking these herbs for a prolonged period of time causes evaporation and destruction of many active constituents. Therefore, these more volatile herbs, often leaves and flowers, should be added at the end of the cooking time for the main formula, so that they are decocted briefly, simmering for no more than 5 minutes, long enough to release their potent influence without diminishing their actions. The practice of adding the herb at the end of the cooking process is referred to in this text as post decoction. Pharmacological effects of this category of herbs include diaphoretic, which means stimulating perspiration, antipyretic, which means reducing fever, sedative, antibiotic, antibacterial, metabolic, which means hypoglycemic, so that is lowering sugar in the blood and raising the metabolic rate, diuretic, which means promotes urination, cardiovascular, and they say here increased perfusion of the coronary artery, so it's helpful for the heart. Antispasmodic, so that helps prevent spasms, muscle spasms. Analgesic, so it helps prevent pain. Anti-inflammatory. And anti-venin, which means it helps in venoms. It's an anti-venom, basically. Good quality Chái Hú. According to Bensky et al., the best quality has a dry and long main root, no sprouts, and only a few hairy lateral roots. Bensky has a good description of what's good quality, but the book that I really use for quality is Chinese Medicinal Identification and Illustrated Approach. In that book by Zhao and Chen say Chái Hú in general should be cylindrical or long conical shape, externally dark brown or light brown, with a hard, pliable, and not easily broken texture, a faintly aromatic odor, and a slightly bitter taste. And superior quality is thick and long and lacks remnants of rootlets. So we do not want rootlets on this. That's both of them are saying that's very, very clearly. The good quality does not include rootlets. Chinese medical actions. According to Bensky and his team, Chái Hú resolves lesser yang disorders and reduces fever. For alternating chills and fever accompanied by a bitter taste, flank pain, irritability, vomiting, and a stifling sensation in the chest associated with the lesser yang stage of externally contracted disorders. Also used as an auxiliary herb for heat from deficiency. It also spreads liver qi and relieves constraint. Now this is an interesting one. So that first one makes perfect sense. It's in the relieve the exterior. That's why it's classified in this category of herbs. But we often use this herb to spread the liver qi and relieve constraint, which is usually a different category, which is the regulate qi category of herbs. And this, it's always a bit of an argument whether this should belong in the release the exterior category of herbs or should be in the regulate qi category of herbs. And that's because of this function. It spreads liver qi and relieves constraint. For a constrained liver qi with such symptoms as dizziness, vertigo, chest pain, chest and flank pain, emotional instability, or menstrual problems. Also used for disharmony between the liver and the spleen with such symptoms as epigastric and flank pain, stifling sensation in the chest, abdominal bloating, nausea, and indigestion. Now this disharmony between the liver and the spleen, a lot of people in Chinese medicine say that's sort of the modern disease state that we almost always, like most of our patients will have some disharmony between the liver and the spleen. At least those that aren't elderly or too young are going to have a liver-spleen disharmony. So this explains why this herb is used so frequently in Chinese medical formulas that we prescribe today. Finally, another function of this, according to Bensky, is raises and lifts the yang qi, specifically the clear qi of the stomach and gallbladder. This is for prolapse. Prolapse is the organs are not where they should be, basically. Sensations of dragging downward, hemorrhoids, vaginal discharge, bleeding, or exhaustion. So it has this very clear movement of upwards. All of these symptoms can indicate an abnormal descent of qi with an inability to rise, and Chái Hú will help that rising and restore that abnormal descent. Brennan Wiseman say it harmonizes and resolves the exterior and abates heat, courses the liver and resolves depression, and uplifts qi. Chen say this superior class herb harmonizes the exterior and interior, spreads the liver qi, and relieves liver qi stagnation and lifts yang qi. So there's a little bit of a mistake here, and I'll correct this as I redo, as I go over it. It says this superior class herb. So the superior class, when we say superior class, we're actually talking about the Shendong Ben Cao Jing. It should belong under the heading of Shendong Ben Cao Jing, which we're going to cover in just a minute. But the Shendong Ben Cao Jing puts herbs and substances into three classes: superior class, middle class, and inferior class. And superior class are usually herbs that can be taken long term and have benefits outside of just treating a specific disease, while middle class is good for treating a disease, and then the inferior class should only be used when necessary to treat a disease and then stopped. So in other words, the Shenang Bensa Jing, which is, remember, that book that first talks about individual herbs, that we, at least that we have, puts this as a superior class herb, which means it's relatively safe according to that. Before we get there, let's talk about Zhao and Chen. That's our book that talks about the quality of herbs and that. And they say, Zhao and Chen say, it harmonizes the interior and exterior, courses the liver, resolves depression, upbears yang, and raises the sunken. And now let's get into the Shenang Ben Jing. So remember, the Shenang Ben Jing, or Divine Husband's classic of the Materia Medica, is our oldest existing book. It does include older indications for these herbs, not necessarily how these herbs are used in modern times. And also, often it includes a little bit of magic, like herbal magic in it. And I mean that literally, like there's some magical properties to this, and that's not always, I don't think, yeah, there's a little bit of that here, but not too much. So let's hear what it says. So the Shenang Ben Jing says, it mainly treats bound qi in the heart, abdomen, intestines, and stomach, drink and food accumulation and gathering, cold and heat, and evil qi. It weeds out the stale to bring forth the new. Protracted taking, so that's why it's a superior class herb, is that you can take this protractedly. Protracted taking may make the body light, brighten the eyes, and boost the essence. And essence is one of the core qualities of the body, so that's a good thing if it boosts the essence. Though I would say that modern times we do not consider this herb to boost the essence. So that's our Chinese medical actions. Let's talk about preparations. Bensky and his team discuss 5 types and preparations for this herb. Northern Bupleurum, or Bay Chái Hú. This is the root and the occasional stem of B. chinense, which is our mainline species here, which has been cleaned and sliced. It is produced in the northern provinces of Liaoning, Hebei, and Henan. Its root is larger and firmer with less twists. Thus, it is also called hard Bupleurum, or Ying Chái Hú, because it is usually harvested in autumn. Another name is autumn Bupleurum, or Jiu Chái Hú. Northern Bupleuri Radix Chái Hú is generally thought to have a stronger harmonizing and heat-clearing action that is best in its unprepared form. It is most often used for diseases of externally contracted heat. Treasury of words on the Materia Medica, or the Bensao Hui Yan, written in the Ming Dynasty, which lasted from 1368 to 1644, observes, in the major and minor Bupleurum formulas from the discussion of cold damage, Zhang Jing used Northern Bupleurum. So that's important, because those, we also often talk about discussion of cold damage, or Shanghan Lung by Zhang Jing. This is the first, along with the Jingui Yao Wei Feng, which is Golden Cabinet, 1,000 ducats, prescriptions for worth 1,000 ducats from the Golden Cabinet, something along those lines. Those two were one book by Zhang Jing that were split into 2, and these are the oldest existing books on Chinese formula. So this means it's a very old, used in very old formulas as well. That was Northern Bupleurum. Let's talk about Southern Bupleurum, non-Chái Hú. This is the root or whole plant of B. scorzoneri-folium, cleaned and sliced. It is produced in Sichuan, Hebei, and Jiangsu provinces. That from Sichuan can be specified as Sichuanese Bupleurum, or Chuan Chái Hú. Its root is thinner and more pliable than the northern variety, with more twists and turns, and is therefore also called thin Bupleurum, Shi Chái Hú, or soft Bupleurum, Ruan Chái Hú. Some places will only ask for the root with a brownish red surface, which is called red Bupleurum, or Hong Chái Hú. Southern Bupleurum is generally regarded as better for spreading liver qi and releasing constraint, and would therefore be most appropriate in formulas such as rambling powder, Xia Yao San, and Bupleurum powder to dredge the liver, or Chái Hú Shugan-san. Spring Bupleurum, or Chun Chái Hú. This is the young whole plant of southern Bupleuri Radix, Chái Hú, picked in springtime. The wholesale trade name is sprouted Bupleurum, or Yoo-hoo. I read that and I cracked up. It's Yoo-hoo, and at least in the U.S., Yoo-hoo is basically a chocolate milkshake bottled thin chocolate milkshake. I guess chocolate milk kind of bottled. Its effects are similar to those of southern Bupleurum, but as a young sprout, it has a very perfumed aroma and a light clearing texture, qualities which embody the lifting and spreading nature of springtime qi. Its dispersing and draining actions are strong and particularly well suited to encouraging the spreading penetration of liver qi. Then we have as a preparation dry fried Bupleurum, or Chow Chái Hú. In this form, the herb is dry fried until lightly scorched, sometimes with wine or bran. Once fried, its cooling action is reduced, but its ability to lift the clear yang is enhanced. It is thus most appropriate for formulas such as tonify the middle and augment the qi decoction, or buzhang yi qi tang, which is a very raising sort of formula. Finally, we have vinegar Bupleurum, or Su Chái Hú, mixed with vinegar and fried over a moderate flame until the liquid is absorbed. This method of preparation focuses the actions of the herb on the liver channel and enhances its ability to soothe the liver, harmonize the blood, and stop pain. This is most appropriate for formulas such as Revive Health by invigorating the blood decoction, or Fa Yuan Huo Shui Tang. Note: the term Chái Hú covers all types and forms of this plant, such as root only or the whole plant, although some regard it as a short name for northern Bupleurum. Stellaria radix, or Yin Chái Hú, is a completely different herb. Even though it has Chái Hú in its name, it is different. It is a completely different herb. Chen Chen, we're still talking about preparations of this herb. Chen Chen, sorry, I didn't go over. There we go. Chen Chen says unprocessed Chái Hú has a stronger effect to ascend and disperse, and is commonly used to release the exterior and reduce fever. The vinegar fried herb more effectively regulates liver qi and is commonly used to relieve hypochondriac pain, abdominal pain, and menstrual cramps. They also discuss the two types of Chái Hú. Bei Chái Hú, Radix Bupleurum chinensis, harvested in northern China, is generally used as the standard source for Chái Hú. It has an excellent ability to disperse stagnation and treat liver qi stagnation accompanied by heat. Non-Chái Hú, or Radix Bupleurum scorzonera folium, harvested in southern China, has a milder overall function. That is in contrast to what Bensky and his team say. They say that the southern, the non-Chái Hú, is actually stronger in dispersing qi, but they're saying, Chen Chen say that's not the case, that the northern is better for almost all functions. Okay, did have Ralph ask about comparing this with other Western herbals, and unfortunately that would be an entire hour or two on its own, so I can't really do that here. But here are some Western uses of this herb itself. The PDR for herbal medicines does have an entry on Chinese thorough wax, and they have in parentheses Chái Hú, and discusses unproven uses and says Chinese thorough wax is used for inflammatory conditions. So what it had was unproven uses and then Chinese uses. So I didn't include the Chinese uses because we've been talking about the Chinese uses. So these unproven uses, I think, are Western approaches to this herb, because that is not, we don't think in Chinese terms, we don't think of Chái Hú being used for inflammatory conditions. That's just not how we view this herb. So I think that's more of a Western use and Western view of this herb. It also does have an entry on WebMD, which, if you're not familiar with, is a good, basic source for a lot of herbs and supplements. And they say it might help stimulate the immune system and protect the liver. People use Bupleurum for asthma, depression, flu, hepatitis, liver cancer, and many other conditions, but there's no good scientific evidence to support these uses. So when I'm looking at this from a Chinese point of view, yeah, we would use it for flu. I could see it being used for hepatitis and potentially liver cancer. Asthma, with other herbs, maybe, but by itself, no. And depression, absolutely. This would be, again, we wouldn't use it alone, but it certainly would be an herb we could use for depression. And when I think of like depression formulas, I think Chái Hú would be in all of them. So yeah, I think that would be an appropriate use from a Chinese perspective as well. All right, let's talk about the commentary on this herb. Bensky and his team, as usual, has an extensive commentary about this herb. And here we go. Entering the gallbladder, liver, pericardium, and triple burner channels, Bupleuri Radix Chái Hú is bitter, acrid, cool, and light in weight so that it raises and disperses to vent the exterior and drain heat. This rising action also raises the clear qi of the stomach and gallbladder, and in conjunction with its acrid dispersal, restores the normal movement of liver qi in order to relieve liver qi constraint. Materia Medica texts, both ancient and modern, seem to be equally divided on the question of whether to classify Bupleuri Radix Chái Hú as neutral or cool. The problem appears to have begun with Divine Husbandman's classic of the Materia Medica, which listed it as bitter and neutral, while most of its applications in the equally revered but slightly later discussion of cold damage involve heat. In other words, it's cooling. Rectification of the meaning of Materia Medica puts the case as follows. The use of Bupleuri Radix Chái Hú lies in its cooling dispersal, which pacifies liver heat. Because its nature is cool, it thus releases alternating chills and fever, tidal heat in the muscle layer and exterior, fire blazing in the liver and gallbladder, painful clumping in the chest and flanks, and also treats sores and heat in the blood chamber. So the chamber of blood is this sort of, not really, but it's sort of there in Chinese medicine. It's an important thing. We think about the blood can get stuck there, and so we need to, or it can be heated or something, so it needs to be treated at certain things. But it's not necessarily a physical thing. And I just want to talk about tidal heat. When in Chinese medicine we talk about tidal heat or tidal fever, it usually means that it gets worse later in the day. The heat, the sensation of heat. Because of this division of opinion, most texts choose one side, then note an authority which states the other, or, like Materia Medica arranged according to pattern and seeking accuracy in the Materia Medica, opt for both and simply say neutral and slightly cool. Well, that's an interesting. As to its other effects, Bupleuri Radix Chái Hú has a rising, spreading, and draining nature with a relatively good heat-clearing action, particularly for eliminating a pathogen at the lesser yang, half interior, half exterior level. It also lifts the yang qi and regulates liver qi to relieve constraint. The range of symptoms that this herb addresses is remarkably broad, including the alternating chills and fever associated with a lesser yang stage pathogen, prolapse or diarrhea resulting from the sinking of yang qi, distending pain in the chest and flanks, plus menstrual irregularity due to liver qi constraint, skin conditions, and diseases of the eye and ear. In addition to the most common uses of Bupleuri Radix Chái Hú discussed above, a few others deserve comment. Heat from deficiency. There are two common ways that Bupleuri Radix Chái Hú is used for this purpose. The first is for treating deficiency consumption with steaming bones and tidal fever, where Bupleuri Radix Chái Hú is used because of its broad cooling effect on the liver, gallbladder, heart, and pericardium. The second common way is for raising yang and dispersing fire so as to spread and expel heat in the muscle layer and skin. This is referred in the adage, constrained fire should be discharged. Li Shizhen noted that when there is deficiency consumption in the spleen and stomach with heat, or yang qi sinking downward, then Bupleuri Radix Chái Hú is the only herb to guide clear qi and reduce fever It is absolutely necessary. That's awesome. So another one of these common uses of Chái Hú include gynecological disorders. This herb is very commonly used in treating women's disorders. Li Gao pointed out that it focuses on blood in the yin organs, while in the channels it focuses on qi, which makes it a perfect choice for gynecological disorders, where qi and blood regulation is paramount. It can regulate menstruation, treat heat entering the blood chamber, relieve qi constraint, cool puerperal fever, and accomplish many other tasks if properly assisted. In gynecology, great emphasis is placed on differentiating qi and blood pathologies and determining the degree of heat or cold. Thus, herbs. Okay, yeah. All right. And finally, other uses. For boils and furuncles, Chái Hú is used to disperse clumped qi and blood in the channels. Li Gao notes that it is similar to Forsythia fructus lianchao in that way, but must be accompanied by reducing and dispersing herbs. Chái Hú is a commonly used herb for eye and ear diseases because it enters the lesser yang and terminal yin channels to disperse heat and channel and can be used as a guiding herb into those areas. Important formulas worth 1,000 gold pieces combines this herb with several others to do this. And I'm not going to get into all those herbs. Okay, there we go. So comparisons. According to Bensky and his team, Bupleuri Radix, Gauguin, Chái Hú, and Simisafuga Rhizoma, Shengma all release the exterior and raise the yang qi in terms of their ability to reduce fever. Chái Hú is most effective and is used in treating intermittent chills and fever. Combinations. Bensky and his team discusses 4 combinations of this herb with others. We will discuss 3 of those here. With Bupleuri Radix Wang Qin, this combination is a pillar of the clinical strategy of harmonizing, exemplified in the discussion of cold damage formula, minor Bupleurum decoction, or Chái Hú Tong. Chái Hú is bitter, cool, clear, and light, with a rising nature that excels at forcing a pathogen at the half exterior level of the lesser yang out to the exterior where it can be dispersed and relieving qi level constraint. Bupleuri Radix Huang Qin is bitter and cold and excels at cooling liver and gallbladder qi level heat, internally resolving a half interior pathogen. This combination is also frequently used for the gynecological condition known as heat entering the blood chamber, or rei shui shi. This can occur if there is exposure to an external pathogen during menstruation, leading to fever, chills, and the characteristic delirium. With Bupleuri Radix alba, or Bai Xiao, the liver stores blood but also spreads and drains. Thus, its form is yin while its function is yang. The nature of Chái Hú is acrid and dispersing, and it mainly enters the qi aspect. The nature of Bupleuri Radix alba, Bai Xiao, is sour and soft, and it mainly enters the blood aspect. Therefore, while Chái Hú dredges and spreads liver qi, harmonizing its function, at the same time, Bupleuri Radix alba, Bai Xiao, nourishes the liver blood, thereby tonifying the liver's yin aspect and moderating its hard yang aspect. With the liver softening provided by Bupleuri Radix alba, Bai Xiao, the qi mobilizing action of Chái Hú can soothe the liver without excessive dispersal and drainage, which might otherwise injure the liver yin and blood. In fact, some physicians make it a rule to never use Chái Hú without adding Bupleuri Radix Bai Xiao to the prescription. Movement and stillness each play a part in this combination, and form and function are both considered. It is therefore frequently prescribed for the extremely common clinical presentation of liver blood deficiency with liver qi constraint. With Bupleuri Radix Qian Hu, the aroma of Chái Hú frees constraint and is very light in weight, enabling it to ascend. It raises and disperses, draining heat and dredging the exterior. Bupleuri Radix Qian Hu is bitter, acrid, and slightly cold, specializing in directing qi downward and expelling phlegm, while also dispersing wind and relieving fever. Together, Chái Hú lifts and opens up areas of constraint, while Bupleuri Radix Chái Hú quells rebellious qi and directs it downward. One rises while the other descends. This regulates the rise and fall of the qi dynamic, regulating the clear dissemination of lung qi while also dispelling wind heat. A far better result is thereby achieved than would be the case from using only herbs that direct the lung qi downward. Thus, the combination has a pathogen-expelling, cough-alleviating action, which is commonly used when wind heat constrains the lungs, leading to a stifling sensation in the chest and a productive cough. It is so frequently used that physicians will sometimes simply write the 2 Hu, literally 2 barbarians or Hu, in their prescriptions. Contents of this herb. According to Bensky and his team, the contents of this herb include triterpene saponins and lots of volatile oils. Chen say it contains triterpenoids, including psychosaponin A, B, C, D, and E, psychogenine F, G, E, and psychoside. Essential oils 0.06 to 0.16%, and lists R-heptolactone and R-decalactone, carbohydrates, flavone, coumarin, and organic acid. And the pharmacology of Chinese herbs agrees with these and focuses on the psychosaponins. The science. According to Chen and Chen, I just real quick see that will work. There we go, that'll work. According to Chen, this herb is analgesic, antipyretic, sedative, anti-inflammatory, hepatoprotective, cholagogic, which means it causes secretion of the bile, anti-hyperlipidemic, so it helps with cholesterol and fats in the blood, immunostimulant, and antibiotic. They also quote several studies showing positive results in the following cases: common cold with 666 subjects, n equals 666, so pretty good coverage with other herbs. Cough with an n equals 1005, and hyperlipidemia with 86 patients. And 2 studies used injected Chái Hú for erythema, which is redness. There were 13 people in that study, and globus hystericus, which is more in line with what we were mentioning earlier with plum-pit qi, and that was 25 patients, so not too many. Drug-herb interactions. There does not appear to be any cyclone P450 or P-glycoprotein interactions with Chái Hú. A large epidemiological study, n equals 1,795, did show increased adverse effects in patients taking Chái Hú, Zhizhe, Wuweizi, Xu Shengdiwang, Mutong, and Qi with clozapine, quetiapine, and olanzapine. And those are going to be antispasmodics, antiepileptics. The American Herbal Products Association's Botanical Safety Handbook puts this herb in interaction class A, herbs for which no clinically relevant interactions are expected. So it's a good safe herb for drug-herb interactions in general. But there are some concerns about this herb. Bensky and his team say under cautions and contraindications, because this is a rising and dispersing herb, it should not be used when the true yin has been severely damaged or with hyperactivity of liver yang. Under toxicity, they say 1 case of allergic reaction was reported after oral administration. Symptoms include pruritus or itching and popular rash, which means that there's a little bit of pus in there, accompanied by dizziness, headache, a sense of oppression, or even pain in the chest. This herb should not be given intramuscularly, as this can readily lead to an allergic reaction. Chen echo these concerns, saying Chái Hú has ascending and dispersing functions, so prolonged use or overdose may consume yin. Therefore, this herb should be used with caution in yin-deficient patients, those with yin-deficient fire, liver yang rising, or liver wind rising. Chái Hú should not be used for an individual having only an exterior syndrome, but no interior symptoms or condition. Use of Chái Hú under these circumstances may lead the pathogenic factor inward, making the disease more difficult to treat. So that's an interesting caution there. Brandon Wiseman say, warning, Chái Hú is upbearing and dispersing. It should be used with caution in ascendant hyperactivity of liver yang, stirring of the liver wind, yin vacuity with effulgent fire, ascendant counterflow of the qi dynamic, and liver flaming upward. And finally, the American Herbal Product Association's Botanical Safety Handbook puts this herb in safety class 1, herbs that can be safely consumed when used appropriately. And that's our herb for the day. We started with a look at something a little different, a Chinese herbal legend about today's herb. Then we looked at another single Chinese herb, Chái Hú, Bupleuri Radix, or Bupleurum. This herb is incredibly important and commonly used Chinese herb and is useful in lots of conditions. And while it may have some cautions, when used appropriately, it seems to be a relatively safe herb. And that was another exploration of a very helpful, important, and commonly used herb. In our next episode, in 2 weeks, we will explore another herb of the world, milk thistle, or Silybum marianum. This is a very common herb used to treat and quote-unquote cleanse the liver. But does it work? Is it safe? Who, if anybody, should take it? We will answer these questions and more. And as usual, we will be adding something a little different. It's going to be another enlightening discussion of herbs, so please join us in 2 weeks. And I'd like to say thank you very much. If you like this podcast, please do us a huge favor. Think about subscribing in your favorite podcast app, or give us 5 stars. We would love it, and we appreciate you just even thinking about any of that. And don't forget our amazing continuing education deal at www.integrativeMedicineCouncil.org/CEUS1, and you get over half off and a free book, and you get to choose what you want. You can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. And as usual, we have a nice bibliography. And thank you very much.